Hi, have you began your GLP-1 journey for 2025? Been on your GLP-1 journey since 2024, 2023, or maybe even 2022? Well, if you haven't yet started but are thinking about it, here's a few tips to help you have a conversation with your doctor. I'm a regular person like you who happens to be on a GLP-1 receptor agonist for over 80 weeks. My experience is just that, my experience, and I'm sharing it with you. I do know of some of the contraindications, the skinny on what not to do. It can be hard to think of a GLP-1 like Ozempic or Mounjaro as a miracle drug. These long-awaited miracle drugs that we should probably be putting in the water and rubbing on our bodies like an expensive lotion. And it's true, they have the potential to help a lot of people. However, there are definitely groups of patients who should not take these drugs or should take them with caution. They include the following. Patients with a family history of certain cancers. Given that GLP-1s can increase the risk for thyroid cancer, patients with personal or family history of medullary thyroid cancer or multiple endocrine neoplasia Type 2 should not take these drugs. Gut movement issues. Since one of the primary mechanisms of action for these drugs is to slow down the gut, patients with gastroparesis, diabetic or otherwise, or other gut issues should avoid these drugs. Patients with inflammatory bowel disease also should not use GLP-1s. Pancreatitis. These medications can increase the risk for serious pancreatitis on their own, so use in patients with pancreatitis already is not recommended. Renal impairment or a condition where the kidneys are not functioning properly. And finally, pregnancy. These drugs generally should not be used in pregnancy in people of childbearing age with the ability to become pregnant. So if you do still have the ability to become pregnant, you should be using a contraception with the medication. GLP-1s are great medications and have the potential to revolutionize obesity medicine. Like all drugs, it's important to use them safely. Knowing how to have healthy conversations with your primary care physician, endocrinologist, and other subspecialists you may have. Good luck!